Motherhood is all-consuming.
Having babies, nursing, feeling the fear of loving someone that much.
And there's this baby on your chest and boom, your entire life has changed.
It's a privilege of being your child's safest space and watching your heart walk around outside of your body.
The truth is, I can be having the best time being a mum 1 minute, and then the next I'm questioning all my life choices.
I'm Lo Mansfield, your host of the Lo and Behold podcast. Mama of 4 littles, former labor and postpartum RN, CLC, and your new best friend in the messy middle space of all the choices you are making in pregnancy, birth, and motherhood. If there is one thing I know after years of delivering babies at the bedside and then having and now raising those 4 of my own, it is that there is no such thing as a best way to do any of this. And we're leaning into that truth here. With a mix of real life and what the textbook says, expert insights, and practical applications, each week we're making our way towards stories that we participate in, stories that we are honest about, and stories that are ours. This is the Lo and Behold podcast.
If you are currently expecting a baby, or maybe you've had one in the past, I'm sure that you are very aware of the fact that doulas can significantly impact birth outcomes for the better. And if you didn't know that, well, now you do. It is very, very true. And it is also very evidence-based that they can just remarkably change what happens in your birth with a lot of specificity related to rates of induction or rates of cesarean, things like that. They play obviously a massive role. So if it's something that you can afford or you can add to your birth plan, it is something that I almost universally would say, yes, go for it. Go for that doula. Today, I got to talk with Sarah Osborne. She has been a full-time birth doula for 17 years and has attended over 900 births as a doula. She is also a birth photographer. I love her birth photography, a childbirth educator, and a doula mentor. If you are considering being a doula and you have any interest at all in some sort of mentorship, definitely check that out via Sarah's website. Sarah lives in the Pacific Northwest, so there's a little hometown love connection with her that I obviously love as well. She lives with her husband and her 3 big kids, and of course, her 2 cats. I so enjoyed this conversation with Sarah today, not just because we broke down some basics for you, right? I want you to know what a doula is, what they can do, what they can't do, why it matters, but also because in this convo, we kind of delve into navigating the work that doulas do in the birth world and then social media and how there's kind of this overriding narratives between what people think about doulas or how they speak about doulas, and then also how a doula has to kind of show up and present themselves in the world when those narratives are flying around above our heads, whether or not they are true. I found this conversation super interesting. You will see that Sarah has just a beautiful heart for birth, for the families that she serves, and I think that comes through very clearly as you guys listen to us chat. Hi, Sarah. I am so excited to have you here with me. Why don't you go ahead and introduce yourself a little bit, and then we'll just jump into our conversation.
Yeah, I am Sarah Osborne. I have been a doula for 17 years full-time. I've attended over 900 births as a doula. I'm also married. I have 3 kids. I live in Washington State.
Sarah and I share that little connection. So we know each other kind of professionally and I would say like friendship now too. Mm-hmm. But as soon as I found out she was from Washington State, I feel like my heart just like lit up a little bit because I still love where I'm from. Yeah. I'm actually going to be back there soon. Present day, we're recording this right before the 4th of July, and I'll actually be up there over the holidays, which is like the best time to be in the Northwest. So yeah, I felt like a little kindred spirit. Yeah. Which probably makes no sense, but just from that right away. So, okay. So before we started recording and hit record, Sarah and I were just talking about kind of like why she does what she does. And I had said that I woke up, I had a friend call me, she's pregnant. She thought she was going into labor. I said, I'll be your person in the middle of the night to watch your kids. So she called me at 2 a.m. I ran over to her house, was there. She ended up actually coming home the next day. It was false labor, but I was exhausted. I was telling Sarah, I was so tired. And so I kind of was just saying like, man, I hated being on call as a nurse and I hated working nights. And I obviously like loved the work, but hated that part. So essentially what I'm getting at is 1, Sarah, you're amazing. All doulas are for doing this work over and over and over again. And then 2, how'd you end up here? I know you've been doing this for a very long time.
Yeah.
How'd you get here?
Well, how did I get here? I mean, I started
Yeah.
slow, right? I knew I wanted to be a doula when I learned what a doula was, which is when I was pregnant with my second baby. That's when I found out doulas are a thing. I actually hired one for that birth. And ever since I learned that was a job, I was like, oh my gosh, I totally want to do that. But I had to wait, for like timing to be right and all of those things. And so I started out slow, like got my training and all of that. But, it takes time to like have clients hire you and slowly work into like a full-time practice. But I just never quit and I loved it. And so, it slowly built over I think my goal in my first year was to go to like 12 births in my first year as a doula, which is kind of a lot actually, but like one a month is what I was thinking. And I did it. And then from there, it just like, snowballed. So yeah. So I was a full-time like solo doula for the first 12 years. So like everything was just me. I was the only doula on call. And now I have a collective where I work with 2 other doulas. And my workload has not gone down at all. In fact, it's probably increased. But
it seems like it has.
Yeah, I do have like that load of sharing like some on-call time and, other responsibilities. So
yeah,
it's pretty great. However, I do pretty much live on call.
Yeah. Yeah.
Like
it feels like you
24/7.
are. Sarah posts like this little thing on her Instagram each time she says, I'm birth bound, like headed to a birth. And obviously our algorithm doesn't feed us everything actually immediately when it's happening. But I sometimes I see your account and I'm like, she's been at 12 births in the last 4 days. How is this possible? So it does seem like you are just helping a lot of families and that you are, I guess, just in it consistently, like you're saying, that there's not a lot of breaks or pauses or stillness. So yeah. So that I in that answer too, there's a couple things I want to zoom in on really quick. One of them sounds maybe a little bit fundamental, but why don't you just explain to everyone what a doula is and kind of those boundaries of this is what I can do and this is what I can't do, so people understand that difference.
Yeah, that's a great question. So a doula, how I describe it, is like a labor coach. So I am like you're the parent's personal hired person to be labor support. So I'm helping with position changes, comfort measures, pain coping ideas, education, information, making sure, that they know all the pros and the cons and like, feel like they're getting all the information to make informed decisions and that they're communicating well with their care provider. And, there's also like a little bit of advocacy in there, but also as a doula, like legally, I cannot speak for someone. So I'm never going to tell a doctor, I'm not going to speak to the doctor and say, don't do that. Instead, this is how I explain it to clients is I say, instead, I will just ask a question in front of everybody and say the doctor wants to cut the cord, right? And maybe they want a delayed cord clamping. This is just my example. Instead of me talking to the doctor and saying like, don't do that, I'm instead asking in front of the doctor to the parents, like, oh, it looks like he's going to clamp the cord. Are you ready for him to do that? Like, is that okay with you? Did you want to wait? So it's like bringing to the parents' attention, like, oh, this might be something that wasn't in your plan, and giving them the chance to speak up because maybe they don't care and I don't care. Right.
Right.
Like I just want them to make their own decisions. But it's also like when I say it out loud, then usually the doctor's like, oh, well, wait, maybe I need to wait.
It's actually like that specific piece of it is like, obviously the labor support, hands-on stuff, so valuable, right? But that part right there, I actually think is almost one of the most valuable pieces because in the hospital, we just do the things we know to do, right? And I'm guilty of that too. So I'm not saying, oh, put me on a pedestal and all these other nurses are down there. Like the placenta comes out, we hang that bag of pit, we're ready to run that Pitocin, right? The cord clamps are on that delivery table. That's just part of the delivery process. Like there's all these things And yes, we should be pausing and saying and confirming with those parents each time. But the reality is we're not. And we should be. And I think an excellent nurse, an excellent provider, they are, right? And you can feel that difference and you can see that difference when you are delivering with someone like that. But since most aren't, maybe they're in a hurry. Maybe they've got 2 moms delivering at the same time. Maybe they have to run to the OR, whatever the, I'm going to say excuse might be. The truth is you're just not always going to get that like pause and that informed choice with each of those things. And it really should be there. So I think so much of the gift of a good doula is exactly what you just said, is just making that pause happen, like being the person in the room who hits that button. Because sometimes I think the nurse as well won't speak, even if they want to. You run into that issue of the doctor, like, why are you always overstepping? Or you might have that feeling from the, I'll say like head provider, where they're saying, why are you constantly kind of questioning the things that I'm, suggesting to the mom, or that's our normal standard of care. And so I think as a nurse, that can be a little bit of a dance because you are obligated to those relationships and your protocols as well. But your doula's only obligation is to you.
Yeah.
Like your job is to serve that family. And so you don't have to worry about what the nurse or doctor thinks of you. And that's a gift, right?
For sure. Yes. Yeah. So, and there's just there's so much. I mean, like, I feel like that's just the tip of the iceberg.
Yes.
But yeah.
Yeah. So really quickly too, I do want people to know a little more. What's it look like? Hey, prenatally, this is what I do for you versus in birth. Cause so many know, you show up at my birth, but what's that look like leading up to labor birth?
Yeah. So every doula is going to work a little bit different in what that looks like. But for me, I usually have a Zoom call to like interview with someone and see if it's a good fit and we want to work together. And I think that's really important. I actually just read on a Facebook group yesterday that there's a doula who doesn't do that. And it kind of shocked me.
Yeah.
Because I'm like, how can you just let someone hire you and you have never chatted with them? Like, that seems not great. Because it's a mutual thing. Like, it's not just them interviewing me. Like, I want to know, am I a good fit for them? Do we vibe, So there's that. Once one wants to move forward, they hire me. That's like contracts, money, all that stuff. And then usually I give everyone, like, I have a separate number aside from my own cell phone. That's like my on-call number. And so they have access to that right away to ask me questions. If they need like resources, information, if they're wondering about like books and classes, or they read something scary online and they're like, oh my gosh, is this true? Like what, all of that. Like, I'm just there. Basically, I say, I'm your Google now. Like, don't Google anything and just text me instead. Yeah. And then I just do one prenatal visit in person. Okay. A lot of doulas do 2 to 3.
Okay.
But I'm so busy and I find that my clients are busy and they're usually working and we just don't need to do 2. So I just do one, and it's typically between 30 and 32 weeks.
Yeah.
And it's pretty long. It's like 2 hours.
Okay. Nice. It's like an intensive, right? And then, but that open access to you, like the idea of truly walking away from Google, if they do that, also a gift, if they recognize that too.
Right. Yes.
You mentioned too, and there just like other things I'm thinking of as well for any moms right now asking themselves, should I have a doula? What's this going to look like? Doulas can work in practices. So maybe if you can speak to that a little, like what that might mean for a family who hires someone who has partners. And then I recently had a student who delivered, and she worked with like an on-call doula group almost, where you just are like, hey, I'm in labor. And I think they kind of send out whoever's on call.
Got it.
So like, to me, that doesn't feel ideal. My guess is it's also more affordable. So there's a lot more that goes into that conversation.
Yeah.
But just maybe questions that a family could ask in those situations to kind of navigate, like, I'm not actually going to get Sarah, or I might get Sarah. So how could that decision process look like for them?
I think it's really important to know, like, how does this doula work? If she's a solo doula, like, who is her backup doula? Because sometimes people want to hire a solo doula, and that's great. And that's the majority of doulas out there, just solo doulas. But knowing, like, every once in a while, she can't come. Like, she's going to be sick. She's going to have a kid that breaks a leg. She's going to have a funeral or whatever. Like this has all happened, right? And if that happens, she's going to send you a backup. And so that backup to you is probably a stranger. And that is a real huge bummer. Like it works out. It's just not ideal. And so sometimes people are fine to like take that chance of like 99% chance it'll work and I'm going to get my doula, but knowing it doesn't always. And then there's also like the partnership model, and that can work in a bunch of different ways. I've seen doulas who have like built-in backup support, but they kind of still have their own clients that hire them within like a group. So you're still kind of guaranteed that one doula that you pick, but you know who the backups will be. And then I actually have a collective myself. So I work with 2 other doulas and we rotate. So that's a different model too. So I think just parents like need to understand what this really is going to look like. There's pros and cons to all of them.
Yep, definitely.
And so just feeling like what feels like a good fit for you. But in my collective, basically our clients, they hire the 3 of us like as a team. So we are all chatting with them on that on-call number, and we all go to the prenatal visit together. So they're not like getting to know one doula better than the others.
Okay, so all 3 of you are at that appointment that you're talking about. Okay. I like that model. Yeah. But then they don't know, your parents wouldn't know who, when they go into labor, it's like whoever's on call that week for your collective or whatever. Yeah. Okay. Yeah. So ultimately, and we did chat about this before we were starting too, it's not too dissimilar from kind of picking a provider, a delivering provider. Right. It's the same questions, right? Like, do you work in a practice? Like, what is the vibe of your partner if they come in? You know, like it pays to do that work. Yeah. Because there's a very good chance the doctor that you love is not going to be the one who actually delivers your baby. And I'm sure in a doula collective, it's similar, right? Like you probably are going to have a favorite, but they might not be the one who gets to come in. Yeah. I think another thing inside of all of that too is you mentioned earlier the word like vibe check. Is there like a specific way you think that families can do that vibe check, or any questions that you think are so valuable? Like when you hear a family say, Sarah, tell me XYZ, fill in the blank for me here, like where you can tell they're really trying to do the work to see if you guys fit together.
Yeah, that is a really great question. And I wish I had a super great answer. So, I mean, I think a lot of times parents will like print off the Google questions of like, here's the questions to ask your doula, you know, if you're interviewing a doula. And a lot of those aren't like, they don't pertain a lot, or they're just like, it's almost like they're just checking off the boxes to like
very generic.
Yeah. So it's okay to like throw that list away and come up with your own questions. Like it's really more personality, because you're gonna spend intimate time with this person and you want to feel comfortable around them. You want to enjoy them, like get along with them. So it should be like, oh, this is someone I like and that I want to spend time with, and I feel very comfortable and like I trust them. It's trying to ask the questions to where, how are you going to find that out as fast as you can versus like, how long have you been a doula? What's, you know, like those questions. Right. But yeah.
I think the reality too is those questions are different for each of you. Like, let's say, I'll just get honest. My mom died right in the middle of me having my first baby. Like maybe I'm asking questions because I want to doula with my second baby around that, right? Like, what's your experience with loss? Like, this is going to impact the way I feel. Like, 100%. You can't really, the generic list, they add some value for kind of fundamental things, but like so much more of fit really does go with what is speaking of myself, my personal history, and how do you feel like you can step into that for me? So you're right. I guess I'm just affirming like we have to be really thoughtful about questions that go beyond the handouts and pertain to what's going to trigger anxiety for us, or fear or joy, and how can that doula maybe step into that?
Yes, 1,000%. And you know, sometimes parents there'll be like this question of like, what's your birth philosophy? Or
Mhm.
sometimes, okay, I don't know how to really phrase this, but I'll just say my example.
Just say it.
So, sometimes I feel like a lot of doulas get into doula work because it's their passion, right?
Mhm.
They are passionate. Like, usually it stems from their own birth experience and like it didn't go well or it did go well or whatever in the middle. And that spurs them on to like, oh, I want to be a doula and help
Mhm.
everybody else have this great birth. And that's fantastic. However, if a doula is if she's in birth work to try and have everyone get her ideal birth, that is not a good fit
Yep.
for anybody,
For
right?
anyone. Nope.
Yeah. So like maybe this doula you're interviewing thinks like a home birth is the best thing. Like that's her ideal birth. But
Mhm.
that might not be your ideal birth. And it's
Mhm.
okay to have differences and not like everyone's going to have their personal preference on how
Right.
they want to birth. That doesn't extend to everyone else. So I
Mhm.
think somehow gathering how you can find out, are they passionate for you to get the birth that you want and help you figure out, even if that looks different from their,
Mhm.
perfect birth.
Yeah, I like it. I talk about that a lot related to my own education in my course because I'll tell students all the time, like I feel like the things I teach or the way I teach, they're not the ones that are going to go viral, right? Like there's not this bias or this slant or this, I'm going to use the word aggression, like, but this aggressive movement towards this one specific experience because I don't get to decide what ideal means for you,
Right.
nor does your doula. I'm certain that, Sarah, you have your own idea of ideal birth, and that so do I.
Right.
My guess is ours aren't even exactly the same,
Right.
but we don't get to put that
Mhm.
on our students or our clients, like
Right.
you're saying. So our job, like you're saying, is to say, hey, tell me what your ideal is, and I'm going to work like hell to help you achieve what feels right for you
Yeah.
guys. And I would agree that a lot of birth providers across the spectrum, like from doula to OB and everything in between, we likely bring our stories in maybe too much sometimes.
Mhm.
And it's such good, important work to keep like the client's ideal centered. And it can be really hard.
Yes. Yeah. No, I totally agree. And I think even, and this is a whole nother subject, but I think even sometimes like doula trainings are not great at that. Like
Mhm.
even the training that they take can be biased.
Mhm.
And that's
Mhm.
a problem.
Yeah.
Yeah.
So that kind of like brings me into this other thing that maybe you can say, no, that's not that pervasive. So it's not that big of a deal. But I do think sometimes there's this mentality or narrative that doulas, they're going to fight for you, right? Or they know how to fight provider. Like
Right.
that there's just this kind of underlying sentiment of the system is going to wreck you, but I'm going to help them not wreck you. And I'm willing to fight. And I think a doula should be willing to step in and help,
Mhm.
like you're talking about earlier, in a way I think that is done well.
Appropriate.
But yeah, I guess, how do you kind of get around that narrative? Like, I know you're not a doula who practices that way of like, I'll fight and I'm aggressive or however you want to say that. And
Yeah.
so how do you kind of get around that with a client and kind of address that, or even publicly on your platform if you're teaching?
Yeah. So, I mean, I think, yes, that is a lot of doulas come out of their training kind of like the system is evil. It's going to not be, they're against us and we're fighting for this.
Mhm.
That is not helpful usually for someone's birth experience, right?
Mhm.
My goal as your doula is to make your experience more positive.
Mhm.
And I want you to have like a good day and have happy memories and not be traumatized, right? That is kind of my like
Sounds
underlying
so simple, right?
goal.
But yes.
and of course that again is going to look different for everyone, right?
Yeah.
Because some people love their doctors and their hospital systems of even like highly interventive, and some people that is the last thing that they want. And so I have to adapt to fit with what my client wants. But I do think going into the medical system, feeling like we're against them and we're fighting for something is not helpful. It's just not. Like,
Mm-hmm.
I want to work with them. I want them to like doulas and see the value in
Mm-hmm.
doulas. And if I'm fighting them or like causing I mean, obviously, if I'm causing conflict, that the parents are going to notice that. And that is
Mm-hmm.
like tainting their birth story in a negative
Mm-hmm.
light, I think. And so if there's something that I think really needs to, like, I've maybe done this twice or 3 times ever, so this is not common, but sometimes I might like talk to a nurse out in the hallway or even talk to a
Yeah.
provider out in the hallway. And that's because I don't want to do it in front of the parents.
Yeah.
Yeah. So I think, I don't know if I'm even answering your question, but I think I, as a doula, want to paint doulas in a good light
Mm-hmm.
to the
Mm-hmm.
medical staff. I want them to trust us because there are good doulas out there who we're doing our jobs correctly and we're not like interfering. And I want the medical personnel to know that.
Mm-hmm.
Yeah.
Mm-hmm.
It's no different than, you just said there are good doulas out there and there are bad ones.
Yeah.
And there are good midwives and there are bad ones.
Right.
And there are good nurses and there are bad ones. And,
Yes.
we could keep going forever. And so I think that's kind of true for so many of us, especially if we have a platform where we're also trying to teach and educate while doing whatever work in our real day-to-day too, is dancing that dance of like, hey, this is the expectation of care you should have. So yeah, fight for this. Like, you don't have to
Right.
settle for less, but then also kind of walking that line of, this is actually not the way it's supposed to be. And I disagree with this. And I
Right.
want you to have a good picture of what, like, I'll use the word like a healthy, relationship with your provider looks like, or a healthy relationship with your doula looks like, or a healthy approach. Like, it's just, it can
Right.
feel like such a battle to present yourself, but also to say like, I'm in this world. It feels biblical. It doesn't mean to be in this world, but not of the world. Like, this is practice that I believe in. This is how I do it. And this is what I think is true about doula work or whatever.
Right.
Gosh. Yeah. Go ahead. You're going to say something.
Yeah, no, I was just gonna say it's like me going in knowing like I want to paint us in a good picture and I want to get along with your team. I want to work with them, not against them.
Yeah.
But that doesn't mean that I'm gonna just go in and like agree with everything. It doesn't
Right.
mean
You're
I'm
not just
be
going to roll over.
passive.
That's not
Yeah,
your job. Exactly.
Right. So
Yeah.
there's a
It's a
way to do it
dance.
well. It can be like a learned skill.
Yeah. Oh, I think it is for all of us, whether that's a nurse or a doula, but especially when, our system has a provider, again, above the nurse and the doula. It's good reason. These delivering providers know more skills, et cetera. But that automatically puts you like under somebody. So then it is that, respectful communication, informed conversations. These all flow from typically a healthy space where everyone is treating each other well, honoring what everyone knows and brings to the table. But there are those kind of, like that hierarchy does exist. And so learning to navigate that and where you are in that, but also being confident to help your family kind of move through that. Yeah, just tough. I don't know that there's a question in that either, but it is a dance for you guys for sure.
Yeah. So I don't know if you saw this too, and I don't even know who said it, but there was somebody on Instagram or social media that said, and she was at OB, I think, and she said recently that she thinks doulas should be like held accountable for giving, medical advice or teaching their clients about like the pros and the cons, or giving them a say in like, maybe we should go this way or not that way or whatever. And that was, did you hear that? Did you see that?
No, but
Okay.
I'm assuming this is like negative towards doulas, right?
Well, yeah, it is.
Like that you're messing things up, causing bad outcomes.
Yeah, because you're not a doctor. And
is
so
that not our job? Is that not your job?
Well, the problem is that like, and I get what she's saying. Like, if you're telling your client really terrible advice that is going to be like detrimental, like that's not cool. Probably that doula actually doesn't know what she's doing, right?
Yeah. Yeah.
But on the other hand, it's making it so that the OB is just the final, like you're the final say.
Mm-hmm.
Because that's not cool.
Mm-hmm.
Yeah.
Yeah.
It's like we can't
gosh.
question you or have other, that's, I don't like that.
Yeah. I feel like social media has changed these conversations so much because maybe a lot of people aren't aware of this because they don't follow like OBs and midwives and nurses, probably like you and I do. But you do see these like in the cloud happening attacks of like OBs versus doulas or OBs calling out nurses. It goes the other direction too.
Yeah,
Like,
right.
don't get me wrong. I'm sorry. I'm sounding very slanted. And the nurses like calling out OBs and everyone's up here like arguing. But gosh, we have to think about that trickle down because what about the layperson who is seeing this? And it just, I just feel, I guess ultimately I just say, I kind of hate that these public forums and arguments are playing out. And we think maybe we're winning our point with some doula we're arguing with online. But what about everyone following that doula and that nurse? And now
Right.
they're like, gosh, these providers don't get along. This system, they're all going to fight with each other. I don't know who to listen to because this one's being rude to this. Like, there's such an impact on
Right.
these public conversations that we're having, including this one. I get it that you and I are having right now on a podcast, but I just don't know that we're thoughtful enough or that it's even possible to keep boundaries around these back and forth combos that are happening. So we're putting a lot of, I don't want to say responsibility. Our patients and clients can handle education, but they're just getting a lot of inputs and some that they don't necessarily need when they're seeing these kind of arguments and attacks and things play out. I just don't know that that's adding value to their experience, but they're definitely, it's getting put in
Right.
front of them.
Yeah. And I think like, honestly, the big question, and this goes for everybody, like doulas, nurses, OBs, is like, who is this about? Like, this is the parents.
Yeah.
Like, it's their
Yeah.
experience. Give them their options. Let them choose,
Yeah.
even if it's not what you would choose. Like,
Yep.
that's really what this is all about.
Yep. It's perfect. I mean, it really is. It's so basic and somehow it's gotten a lot really complicated, but that is 100% the truth. Give them their options and let them choose. Like
Right.
we should be able to trust them with that. They're going to
Right.
be parents and raise that tiny life. Like they can be responsible for making choices, you know?
Right.
So, okay, that I want to talk about one last thing with you
Yes.
that's kind of related to this social media thing we've been talking about as well. So, Sarah and I had been texting a while ago because there was a post that went up from a doula. And I'm sure, I know when Sarah saw it, she was probably annoyed because it was part of this like, oh, great, now I want to go and speak to what this doula had said. But essentially, the doula had shared a post. And on one of the slides, you can add more to this if you want to. One of the slides basically had suggested that lying to your provider is an appropriate choice or like an option. Like just lie to them about what time your waters broke and like that is your right. And so there was different options, she said, but she included very clearly that lying is your right. I guess I'm sitting here going, well, it is your right technically, but it was a suggestion, right? Like,
Right.
hey, lying is a possibility. Here's an option I'm going to give for you is to lie. So I don't have a question in that, but I know that you had feelings about it and you went
Yeah.
live. So speak to us a little bit about that.
She literally was saying, you know, like, so it was something about like autonomy. Like,
Mhm.
once you give that up, like once you tell them the truth that your water has broken,
Mhm.
you are giving up your autonomy to like make decisions, and it's going
Right.
to change the trajectory of your labor and birth. And
Right.
no, that's not true. You can still have your autonomy even if you've given all the facts.
Mhm.
And yes, that might look different than how they were hoping, or have more conversations than you wanted to have, or feel more like an uphill battle. But ultimately, the decision is still up to the parents. Like, providers cannot force you to do anything.
Mhm.
But I also just think that's bad advice in general,
Right.
because they're, you know, like, yes, most of the time it's fine to stay home after your water's broken. Like, I think
Right.
90,
Of course.
95% of the time, I think that's fine. But like, you don't know if this person's in that 5%, and maybe something bad is going to happen because you didn't give that information. And I'm always, especially on this topic, like I'm the doula who will tell people, if you think your water broke, like just text me, call me, like I'll help you figure it out. And
Mhm.
like, if you're meeting the healthy milestones of like, it's clear and it doesn't
Yeah,
smell
the
bad and your
check-ins. Yeah.
baby's moving and all these things, like it's fine. Your GBS negative, like it's fine to stay home if you want
Mhm.
to. If you call your provider and tell them, like they're going to tell you to come in, but also you can still call them and say, no, I don't want to come in, or like, I'm going to wait at home
Totally.
for 12 hours or
Yep.
whatever you want to decide. What they say isn't, you don't have to do it. Like, you can negotiate with them and still tell them the truth. Right. So I'm never going to encourage lying.
Yeah. Yeah. It was interesting because the whole post, I felt like I agree with like 98% of the rest of it, right? Because it is true. You know, a hospital system kind of puts you on a clock when your water breaks, and interventions may then be suggested sooner because that water has been broken, or they want you to come in right away, which I can tell you as the receiving nurse, there, like you said, we're throwing out this number, guys, 95% of the time, but the majority of the time, you do not need to be there right away. It's just, I'm going to say the way we talking about the system is the way we like it, right? We can check on the baby. We can do a quick monitoring, and once you're there, you're staying if your water's broken until you've had your baby. So I think it's just a way to exercise some control and know, okay, this mom's water's broken. She's here and she'll have her baby, you know, at some point. And so I don't want to say none of that's not true. It is true. You and I have both seen all those things play out. But with that post specifically, I think it was like the second that it said, just lie about the time your water broke. I'm like, that, then this entire thing, I'm like, stop. Like, this is something I felt like back away from. There should not be a relationship with a provider in which you have to lie to them to navigate it. There are so many other options, especially like you just said, like, you can see what they say and you do not have to take their advice or the suggestion. Like, that's your autonomy. That's a powerful step to say, thank you. I'll come in 12 hours, or I'll call you back in 8 or whatever.
Right.
But lying is just such a shaky foundation. And there's so many more choices, assuming this is, you're going to the hospital and you're going to finish your process there with them. Like, if that's what we're doing, if that's what we're even encouraging as a choice, I don't know. It just feels like, gosh, too bad we can't back up and fix and correct this way before we got to this point where we think lying should be an option. Sure.
Yeah.
And then I would say clinically too, like, I am not someone who says rush to the hospital. I waited till the last second to go to the hospital with all of my children, and almost waited too late for 2 of them. And it was very exciting. So I don't think you should rush to the hospital, especially if you want unmedicated birth, you know, it's just interventions and interruptions that happen. It's just true. But we need to know what time your water broke, because let's say it is 32 hours down the road. Like, there are some significant risks that can come into play specifically based on the amount of time your waters have been broken.
Right.
Like, why are we going to suggest lying about a number like that? We can suggest autonomy after that choice.
Right.
But to suggest that, I'm like, that felt wild to me, as I know it did to you too. Yeah. And I think ultimately, trying to, like, back to the doula conversation, I think it's frustrating to see a provider that you share, like, you're a doula as well. And then you think, oh gosh, it's super frustrating to have a doula say this or share this when you disagree with what's being shared. So then you feel like you're correcting.
And I don't know who's reading that. Labor and delivery nurses, OBs. And then they're thinking, oh, doulas are just encouraging our patients to lie. Well, then they don't like us because, you know. And again, that's back to, we already talked about this, but that social media thing, it has kind of like brought some of these relationships very public, and it's both good and bad and value and not valuable. But I do think it can be complicated because you feel like, I want to do my doula work and I want to do it well, but shoot, now I have to get online and correct all these things that are happening online. It's too much work. It's too much value. I will say, I love, one of our local hospitals is so great, and they have a super large midwifery practice. And those midwives see a huge amount of births, but they will let a mom stay home. They will let a mom stay home.
They're comfortable
for up to 24 hours after her water has broken. Even if she's GBS positive, they'll have her come in for antibiotics, and then they go back home. Like, that is how everywhere should be.
Yeah. Yeah. My girlfriends who have delivered at birth centers out here, same. And she's been GBS positive with some of them. And I think I actually love considering, hey, how does a birth center handle this? Even if you're in a hospital or that's where you want to be, how does the birth center handle this? How do other countries handle this? Like, you're talking about digging deep in education. And a lot of times I think courses and stuff will say, hey, also, this is what, you know, like the Royal College of the UK says. And that's just actually really valuable because you're not just going on a whim saying, well, I'm good with 24 hours. It's like
Right.
if another country's practicing something,
Yeah.
they feel really comfortable about the evidence in place to
Yeah.
practice that way, which means you can check that out and
Yeah.
lean into it
And
as well.
I
So,
will say that to my clients. Like if they're seeing a more high risk OB at a different hospital who wants them to come in like right away if their water breaks, I tell them like, well, obviously I'm not a provider, but these midwives at this hospital
mhm,
will let you stay home for 24 hours. Like
mhm,
if you were their patient, they would be fine with that. And so that
mhm,
tells me it's not really all that risky,
mhm, mhm,
if other providers are practicing that way. And so
mhm,
like I hear that this is what your doctor's saying, but just know that that is kind of on the very conservative side of
mhm, mhm.
recommendations. So I think that's all just like good info
Yeah.
for like how you tell your clients that stuff. But
Well, and that goes back to what you said when we started, right? Like there's a spectrum here for all of this. I know we're talking specifically about water breaking, but a lot of these choices about when to go in or what to do next or when to start meds or when to call failure to progress or whatever, like
right,
obviously are so incredibly talented, valuable. Many of them have delivered so many babies. But I think it's understanding like they're in this spot on the spectrum. Yes, they know me personally, and that matters too. Like, what is my health history? Because I can't just compare myself to the
for
woman
sure.
next door.
Yeah,
And so I think that's why, like, your job saying, like, here's the whole spectrum,
Mhm.
here's A, B, C, D, E, and F. Provider suggesting F, you're allowed to look at these other ones
Mhm.
and then decide, what feels right is, again, just such the value of a doula is just making sure that you keep reopening that
Right.
conversation so that your clients always do know this is a suggestion. This is another way it can be done. This is another way it can be done. And then I get to decide.
Right.
And birth, especially if we're talking about labor and birth moments, everything's so quick that
Mhm.
the ability to pause and ask for time and space is so, so valuable. And I think that that is just one of the gifts of you guys in that room
Yeah.
is just saying, everyone stop.
Pause.
We
Yeah.
need a minute.
Yeah.
And who cares what you decide?
Right.
Maybe your client agrees, but even
Pause.
just saying like,
Yeah.
pause,
Yeah.
and then they're going to leave. And then you can agree with them in 5 minutes.
Yes.
I just want to know that you felt like you had a minute.
Yes, 1,000%.
Yeah.
And that's what I say in my classes. I'm like, if you, to take that moment to go through like the BRAIN acronym, which I'm sure you're familiar with that.
Love it. Teach it.
But,
It's good.
if I always say like, if you decide to do exactly the same thing your provider is, like,
Great.
that's great and
Yeah.
fine, but you'll feel different about it if you made sure it was like your decision.
Mm-hmm. Mm-hmm. You will know what I'm talking about right now. But in my mind, when I think about my students and sometimes try to like put myself in their place, one, I try to remove that I'm a labor nurse and just be like, remember, if you're just like the one in the bed. And I think about when the nurse turns their eyes and looks at you, the doctor's at the foot of your bed looking at you, and you have like 2 to 4 pairs of eyes looking at you as the doctor or the midwife, whoever, is saying, let's go ahead and start some Pitocin. Like you've been laboring for 6 hours, haven't changed. And I just think about when you're sitting there and there's all these professional eyes on you,
Mhm.
that is the moment where you just need someone, if you don't feel comfortable saying like, can I just have a few minutes with everyone not looking at me so I can just think?
Yep.
Because that, I think about how many times I've been like looking down at a mom, and in my head, I think, I'm there and I'm supportive and whatever, but you're also standing above them, right? If they're in
Right.
the bed, and you're literally putting a spotlight on them, sometimes actually literally with those spotlights going. And what a crappy position to be in to make any choice, even
Right.
when you're more than happy with what they're suggesting. You just don't feel like you're owning it? So
Yeah.
that moment, if you can step into that, if your doula can step into that and give you those spaces, like chef's kiss.
Agree.
Okay, Sarah, let's pause right there. Although
Yep.
I want to ask you 2 quick follow-up things. One, easy, where can people find you, connect with you if they're local to the Washington area where you are, maybe even work with
Yeah.
you? So share that with me. Go ahead.
Yes. So my doula collective website is the Birth Collective PNW for Pacific
Mhm.
Northwest. That's also our Instagram. My website and Instagram is the Expert Doula.
hmm And Sarah shares some awesome, she's a photographer as well. So I love remixing her birth photos. She's given me full permission to do so. Okay.
I love it.
And then explaining what we're seeing and what's going on, because she takes some really beautiful photos. And I love seeing like the interventions, if you will, in a photograph so we can break it down and talk about it. Because obviously everyone's using different tools with a doula and without to have their babies. And so it's so good to see them. I always say, like, when we see birth, we do birth better, because so many of us don't get to see it. And it's really valuable to see it. Sarah's photos are amazing. So definitely check out her personal account as well, just to see things, honestly, that maybe you've not seen before. Okay, last question. You can be as thoughtful as you want about it or just top of your mind, but what's something right now that is sparking joy in your life, just bringing you a ton of happiness?
Oh, what's bringing me a ton of happiness right now? Is that your
Anything.
question?
Yeah, sparking joy. It could be Cheetos. It could be your kids. I don't care. I don't care. Anything.
It's not my kids.
Okay, that's fine too.
I am loving the sun. The weather is great.
I've had a lot of people saying that this summer.
Yeah,
like, people are ready.
As you know from living here, like the fall, winter, spring is long.
The fall, winter, spring. You mean like the 11 months it's gray?
So now it's like the sun is out. It's like 70s. It's perfect.
It is. There's nowhere more beautiful when it is beautiful there.
Yeah.
It is.
And like I put
amazing.
flowers on my porch and I can smell them, which I feel like in the past I haven't really been able to smell them. And that just is wonderful.
It is. It is. All right. Perfect. I love it. All right. Thanks, Sarah, so much for your time. Okay. Talk to you soon.
Okay. Bye.
Thank you so much for listening to the Lo and Behold podcast. I hope there was something for you in today's episode that made you think, made you laugh, or made you feel seen. For show notes and links to the resources, freebies, or discount codes mentioned in this episode, please head over to loandbeholdpodcast.com. If you aren't following along yet, make sure to tap subscribe or follow in your podcast app so we can keep hanging out together. And if you haven't heard it yet today, you're doing a really good job. A little reminder for you before you go. Opinions shared by guests of this show are their own and do not always reflect those of myself and the Labor Mama platform. Additionally, the information you hear on this podcast or that you receive via any linked resources should not be considered medical advice. Please see our full disclaimer at the link in your show notes.